Hi, welcome to our show today. My name is Karen Halloran from Marquis Health Services, and I will be your host. And the show is Marquis Presents Your Key to Healthy Living. March is Women's History Month, and it's to commemorate and encourage the study, observance, and celebration of the vital role of women in American history. So I thought this would be a great time to have our state senator, Joan Lovely, on the show. Thanks for coming on, Joan.
Thank you, Karen. It's a pleasure to be here today.
So great to see you. So maybe we could start with how you got into politics. I think people would be interested in hearing that.
Okay, I'm happy to share that story. So I will admit to you that when I was in my 20s and, teens and 20s, politics wasn't something that I really followed. I really wasn't that interested, local, state, or federal. And it was when I got married and had children that when I really started to take a more of an interest in local politics, what was happening in my community. So I was raised in Beverly and married a Salem boy almost 40 years ago. So we've raised our family here in Salem. And so, I had two children at the time, a 2-year-old and an infant, and I would take them over to the park, which is nearby to my house. And the equipment in the park was the same equipment my husband played on as a boy. So that really hot metal slide and those a couple of rubber swings, that was it. And I just thought to myself, no, we need to upgrade this park. So I gathered some moms in the neighborhood, some parents, dads too, and we formed a committee. And we went to the city and we worked with the planning department and the mayor then and the city councilor. And over the course of a year, we worked on upgrading this park. And I remember it was an October day that we had the playground committee and about 100 volunteers come in and rebuild this playground. So that's going back a few years because my kids are now in their late 20s and early 30s, and I'm a new grandmother. So my 4-month-old granddaughter will play on equipment that has actually since then been replaced. But it was such a great experience, and I really got involved in my community, and I really enjoyed it. And then I was appointed by the mayor to be on what they call, and it still exists, Neighborhood Improvement Advisory Committee. So how to improve your neighborhoods. I really enjoyed that. And then there was an opportunity to run for city council. And my husband reminded me, and he said, I thought you didn't like politics. I thought you really really didn't enjoy that. And I said, you know what? I don't. I don't enjoy the political side. I enjoy the helping people side. So ran for city council, and I was a city councilor here in Salem for 15 years, which was a long time, longer than I ever thought I would. I was also a realtor, so I sold real estate at the same time as we're raising our family. And then I decided at that point when I was on the council that I wanted to finish my undergraduate degree. I had out of high school, had gotten a 2-year degree, an associate's degree in large animal science. And I really wanted to finish that degree. So nights and weekends, I put myself back at Salem State, 6 years, nights and weekends. Wow. I got that undergraduate degree. I felt very good about that. Again, all while I'm on the city council. And then my husband came to me and said, why don't you go to law school? I said, well, I'll only do that if I can go full time. And so I did, and passed the bar on my first try, which was very good, and practiced law. And, at the same time, I ran for state rep. That was in 2004 that I ran for state rep. I lost that race here in Salem. I think anybody that if you're running for office, losing a race is not a bad thing. It really humbles you and makes you kind of regroup on what your future might look like. And then the Senate seat came up when Fred Berry decided to retire after 30 years. God bless Fred. He was amazing. I ran for the Senate seat, and I'm just starting my 5th term. So that's how I got involved in politics and how this journey has kind of taken me up to the state Senate. I'm so proud and honored to serve in the Senate for the district.
That's wonderful. What a great story. It really shows advancement of a professional woman. And I think that's really important for, our viewers to see. That's wonderful. And I was just wondering, what is your role in Senate this session?
So this session, I have the honor of being an assistant majority leader and the chair of rules. So, assistant majority leader, I'm in leadership. So I actually, with the president and her leadership team, making policy decisions on what direction the Senate wants to go this session. So I'm really thrilled to be doing this work. The chair of Rules is an interesting committee. It's a committee that doesn't meet often because what it does is there's about 6,000 bills that got filed this session and every session. So that's a lot of bills by 200 legislators. And so what happens is if it's a money bill, it goes to Ways and Means. If it's a policy bill, it comes to Rules. So Rules is a very busy committee. Once a bill, say, is reported out of a public health bill, and it will come to, that's not a money bill. So it comes to Rules where we make sure that it's drawn properly and ready to go to the floor for consideration by the Senate. So it's a pretty big and pretty busy committee. Some other committees that I'm serving on, Vice Chair of Bills and Third Reading. I'm on the Joint Committee on Housing. That's a committee that I requested with a housing background. And housing is obviously a very important topic right now. So many people are struggling with affordable housing. You know, the rents are so high. I'm on the Senate Committee on Steering and Policy, Senate Committee on Global Warming and Climate Change, and a new committee just formed this year, the Senate Committee on Reimagining Massachusetts, in response to living in a pandemic for the last year. What do we look like going forward? I have a couple of other commissions and caucuses that I serve on. This session, I am the co-chair of the Massachusetts Caucus of Women Legislators. So that's all the women in the Senate and the House. We are 62 members strong. We are at an all-time high. And I'm looking forward to working with all my women colleagues. So we advance the important issues that female lawmakers are pushing. And the last commission that I'm on is the Commission on Postpartum Depression. And so we actually work on maternal health and maternal and fetal health and mortality. And so we want to make sure that pregnant women and women who have delivered and dads are supported. Postpartum depression isn't something we talk about very often, but it is the number one issue for a pregnant woman is postpartum depression. You wouldn't think so, but it is. So we want to make sure that our women are supported as they're pregnant and delivering babies, especially this year in a pandemic. I mentioned earlier that I'm a new grandmother. So I watched my daughter first pregnancy go through a pandemic pregnancy and delivery. And now, you know, having this baby when these couples are very isolated,
Right.
you know. So that is the work that I'm doing starting this session.
You are sure busy with all of the committees. Thank you. How has being a woman shaped your career in politics, including your legislative priorities?
You know, I think I come from this perspective of being a mother, of being a parent. You know, again, my first foray into the political scene was to help families, to build a playground so that families and children could enjoy this really beautiful playground and get together. Because women's issues are family issues, and family issues are really at the core of state policy. I had the honor last session and the session before to chair the Committee on Children, Families, and Persons with Disabilities. And those are now strong policy areas for me to make sure that families are supported, that children are supported, and that persons with disabilities, the intellectual disability, autism, that they are supported. So we are, I'm very fortunate to be able to be doing this work and, you know, leading it, as a mother, as a woman in the Senate. A couple of bills that we did, one bill that we did was the Pregnant Worker Fairness Act. We passed that in 2017, and it protects pregnant women in the workforce. So sometimes a woman will be let go from her job because of a pregnancy, but the employer doesn't think they can do their job. That's discrimination. And so we wanted to make sure that women are not discriminated against because of a pregnancy. And there was one story of a woman of color who worked in a laundry, a commercial laundry, and she was pregnant, first baby, and she was pushing around those giant laundry carts, very heavy, hundreds of pounds. And she went to her employer and said, I think this work is too much for me. Can I get an accommodation? And not only did the employer not give her an accommodation, the employer piled on more work. She lost that pregnancy in the 5th month because of the strain and stress of pushing those giant laundry carts. And so we filed this with her in mind. And so what it does is there's the employee and the employer work on an accommodation. So if someone is in a job that requires, a lot of physical work, that they get an accommodation. But it can be if you're at a cash register that you have a stool to sit on, or you get an extra break during your workday. So you had mentioned March is Women's History Month.
Yes.
And I just wanted to just talk about that quickly.
Sure.
The Senate made history when we saw one Senate president pass the gavel to another Senate president, women. One woman Senate president to another woman Senate president. First time in the history of the Senate. We are in our 192nd term, 2-year term. So do the math, double 192, and we've now had 3 women as Senate presidents and a whole lot of men. And the Senate president, Karen Spilka, when she took the gavel, the suite is filled with photographs or pictures of all the male Senate presidents, and there were 3 women. So she actually, in honor of Women's History Month, covered those pictures with all women who have made an impact all across our commonwealth and across our nation. And so it's really wonderful. And I sponsored a bill this session to enact the Women's History Trail across Massachusetts, so that we know right here in our own state women who have made a major impact. So hoping to get that bill across the finish line and create a Women's History Trail.
That's fantastic. That is really good. That brings about, I have another question for you. What kinds of legislature are you focusing on this session that will impact women in the Commonwealth?
So, again, as former chair of the Committee on Children, Families, and Persons with Disabilities, I like to look at improving the lives of children and families. One bill that I'm working on is child sexual abuse prevention. This is a problem, not just in our Commonwealth, but across the country, really across the world, where children are trafficked. And so we want to make sure that that's prevented, and so that we can actually support preventing it and then support survivors. Another issue that I'm working on is a diaper pilot program. So for families in need, who are choosing between, especially right now with unemployment, we know that some families are recycling disposable diapers. And so that's not healthy for the child, not healthy for the family. Diapers are expensive. We've done diaper pilot initiatives in the State House where we've actually done, competitions to see which office could collect the most diapers and then donate them within our districts. But this will allow, families who are in need to be able to access diapers for their children. We're also filed for a commission on the status of children and youth. This is a very interesting bill because this is through the United Nations, actually. And every country on our planet has adopted this except for 2, the United States, and the other one is in Africa. And that country is escaping me right now. But the U.S. should be championing the Commission on the Status of Children and Youth. And what does it do? It actually brings children and youth to the table to talk about the status of children and how we can be supportive. It's a really long bill, so I'm not going to be able to go into it. We could do it on its own segment, but that's another one. Another bill that I'm working on is safe drinking water in schools. This is with Representative Lori Ehrlich from Marblehead. She and I are filing this together. And currently, because a lot of our school buildings were built before 1978, a lot of the school buildings have lead pipes in the schools carrying the drinking water. We know that lead is extremely dangerous to children. And so what we want to do is come up with a funding stream to be able to get safe drinking water into schools. But likely what we would do, we're not going to tear schools apart and tear walls down and replace pipes. We're going to shut those pipes off and then bring pipe water in separately. And the city of Brockton did this, which is a very big school system, for about $300,000. They did this a couple of years ago. So we know it can be done. We actually have identified every school in the Commonwealth that has this problem, probably 95% do. And we want to make sure that we have safe drinking water in schools. What are schools doing now that know that they have these lead pipes? They're providing other sources of drinking water until we can make it more permanent. So something else that we're doing, again, we're doing legislation to help families deal with SIDS, sudden infant death syndrome. This was a couple that came to me who had lost a baby to SIDS. And when that happened, they weren't given any information or support on where to turn, who to talk to about the sudden loss of their new infant. And so we want to make sure that the medical examiner and the hospital where the infant may be taken to has that support system in place to make sure that couples that have gone through this tragedy have some support. So we filed a bill to have that happen. I've got a bunch of bills, but I'm just going to mention one more. This is improved coverage for 3D mammograms. So this is what they call tomosynthesis, is the type of mammography. And what it does is it's much more sensitive to pick up breast cancer. And we know of women who their insurance won't cover this 3D mammogram, so they have made the choice not to have it. And we know someone who, by the time she was diagnosed, had stage 4 breast cancer. Likely many of your viewers have 3D mammograms, but you may want to ask, when they go in, is this a 3D mammogram that is the most sensitive, and insurance companies should pay for them? Because we know it's much less expensive to catch breast cancer early or in stage 1 than not to have this type of mammogram. And by the time you pick it up at stage 4, and now you're dealing with a whole different treatment modality. So we want to make sure that women are protected. So you can see I'm talking about a lot of family and women issues that are important.
Well, those are wonderful. I mean, they would totally help so many people in the community. I think they're great causes to go and have a bill for them.
Yes.
It's been so tough with COVID, and I'm sure, you have felt it. And I'm just wondering, how do you think the legislature has responded to COVID-19?
So, here we are coming up on almost a year of being in this pandemic. It's been difficult for everyone. And I would say that I probably can speak for everybody about the COVID fatigue that we're all feeling. And we've seen the number one issue that I hear from in my office, the number one call is for unemployment help. People who are they have lost their job and they are trying to access the system. And because of the sheer amount of people trying to access the system, it's a slower response. So anybody who may be viewing this, please contact my office if you're having any difficulties, and I'll give my contact information at the end because we are here to help. And so how has the legislature responded? We've worked closely with the federal government when we got the CARES Act funds to our state to be able to respond with small business support. We're helping seniors to make sure that the senior population is the most vulnerable for COVID. We know that just from the numbers that we've seen. So we want to make sure that people are safe in their homes, or if they're in a nursing home or some type of facility, that they are safe, so that they are safe from contracting COVID. We know it's been very difficult though. Schools, just to look at our education system, each community has had a different way to be able to approach it. Some communities have been completely remote. Some have been hybrid, where the child is in school on one day and maybe 2 days a week and home 3 days a week. It's been very difficult to make sure that everyone has internet access, that everyone has a laptop computer. So back in March and April, every single community, especially here on the North Shore, we made sure that families that struggle to have internet, that they make sure that they have internet. That they did not have a computer in the home, to make sure every child has a laptop. So laptops went home with kids. And there's a lot of remote and again, hybrid learning right now, but it's been hard on families. And I just met last night with the Mass Teachers Association and the American Federation of Teachers, who represent the unions, who really are pushing for teachers and educators, administrators, and school personnel to be vaccinated so that they can go back to school in-person learning safely. I support that as well. And so it's been, we're dealing with food insecurity. We just visited a food pantry here in Salem this week. People are getting nice, fresh, beautiful food, fresh vegetables, make sure that people are fed, again, because people are struggling. Yes. And we make sure that, with the vaccine delivery, it's been a tough one out of the gate. People are we actually get about 130,000 vaccine doses per week from the federal government for 2 million people. So yesterday alone, there were 50,000 doses available for 2 million people. So you can imagine how many people went into the system to try to book an appointment for those 50,000 doses. They were gone in 30 minutes, all those appointments. So we're looking to the federal government to increase the vaccine delivery here, not only to our state, this is all across the nation. So as Moderna and Pfizer ramping up their production, Johnson & Johnson is in front of the FDA getting approval. Once they're all up and producing the maximum, we're going to get everybody vaccinated. That's how we're going to get past this pandemic. And so, again, your viewers, anybody who, please get vaccinated. If you're afraid or you're concerned about it, talk to your medical provider. They're telling us it is quite safe. I'm looking forward to my vaccine. I'm in phase 3, so I'm not sure when that is, but we will be vaccinated, and so that we can get back out and we can start enjoying each other. We will always, not always, but for the foreseeable future, we're going to be in masks. We're going to be distancing, unless you're in your bubble, and we're going to be having to wash our hands. But think about it. Have you had a cold this year? No. Anybody have the flu? There's no flu cases in Massachusetts. And that's because we're being so careful.
Right. Well, it's wonderful to hear all these programs, because people are in such this time. People are struggling. There's so many things going on. This has been a crazy year. So it's great to hear that you're doing that. Are there any resources that you would recommend for seniors or other individuals who may be in need at this time?
Really definitely reach out to your councils on aging. They really are the most local resource for seniors. They may be closed to the public, but they are open for business. So, if anybody's looking out for some resources, whether it might be Meals on Wheels or companion calls, when you have a lot of seniors that are shut in right now, you just want to talk to someone on the other end of the phone. Council on Aging can assist with that. They can assist with if you're having any insurance issues, or if you're having any issues with the vaccine. Make sure you reach out to your councils on aging. We are supporting them so they can support our seniors. And this has been, again, difficult. We know people have COVID fatigue, that they want to get back out. We want to make sure, especially that our senior population is protected, because they're the most vulnerable, as we've seen from the numbers. So, and if, people, again, have any issues that they need attention to, one thing I didn't mention was, housing is particularly difficult right now. There's an eviction moratorium right now, and a mortgage moratorium. So if people are having problems, with their house, or with their, making sure they have a roof over their head, let us know. Again, if people are having difficulty accessing good, nutritious food, let us know. We can make sure we can connect those dots to make sure that everyone is being cared for. And that's kind of a point, people are really caring for each other. We've seen so many instances of people just stepping up to take care of each other. It's really heartening.
It really is, and people just need that right now. I was also going to ask, what about the food pantry if somebody was having food insecurities? I think Beverly Bootstraps is open.
Yes, so Beverly Bootstraps in Danvers is People to People, and in which I believe People to People is open now. I'm wondering if they're again these some of these places may not be open physically. In Salem, there's the food pantry. Actually, we just like I said it, we toured it yesterday, and we also went into down at Shetland Park in Salem, where the Salem Pantry is storing food for all of the pantries across the North Shore to make sure that, because a lot of times you have to drive into the Boston Food Bank in Boston, and maybe a pantry doesn't have a delivery van, or a pickup van. So there's a lot of collaboration, especially in the food insecurity. So I want to make sure that people, yes, Bootstraps and Haven from Hunger in Peabody. And again, if people are having difficulty accessing food, let us know. We can definitely connect people into making sure that they have all the resources that they need. No one should be going hungry. No one should be cold. If you're having trouble with heating, we can get assistance. We want to make sure that people are cared for and during this difficult time.
That's wonderful. I think this has been a great informative time having you on here because there's so much that people need to know about going about this with this virus right now. If somebody wanted to get in touch with you, how would they be able to do that?
Okay, well, the best way. So even though we are not in the State House, the State House actually closed down last March. So like many businesses, the State House is open for. We have by our Constitution, we have to be in a session every 72 hours. So that's Monday and Thursdays. But I'm not physically in the building, and neither is my staff. However, we are open for business, and so our phone actually rings in our homes, and to make sure that we've got someone on the other end of the line. So if somebody needs to get in touch with us, good way is to call, and that number is 617-722-1410. For those people who prefer to use a computer, email is a great way to get in touch with us. And my email is joan.lovely@masenate.gov. And some people actually choose to contact us through social media. So messaging through Facebook or Instagram is also a good way for your viewers who are savvy with computers. And that's how you can find us.
Fantastic. Well, I'd really like to thank you for coming on the show today. It's been very informative, and thank you for taking the time out of your busy schedule and, looking out for all of us. It's much appreciated. And
Karen, I was just going to say, Karen, it's my pleasure to be able to bring this information to your viewers so that they know that government is working very hard to take care of people and that we are accessible and that want people to be able to reach out with any issue. As I said at the beginning, we filed about 6,000 bills just last week. So if people are interested in following any types of bills, whether it's the environment or public health or whatever it might be, contact our office. Let us know what you're interested in, what you like about a bill, and as importantly, what you don't like about a bill. So it's really great. That's how government works. When we hear from the people we represent, that's the best way to make it work.
Well, thank you so much. I'd like to thank you again, and it was great seeing you today.
Thank you, Karen. You as well. Stay well, and to all of your viewers, stay well. To make sure you're taking care of yourselves. And again, reach out if we can help.
And that brings us to the end of the show. I'd like to thank you for joining us today. And until we see you next time, stay safe and healthy. Have a great day.